look at it, so they each have names on them, and some of them I wrote the names in. Okay, so there's some kind of standard names of exercises that aren't necessarily official, but that are used a lot in the profession. So if someone says a quad set, you should know what a quad set is. Okay, so the first two, we have our gastroc versus soleus stretch. We'll do that with lots and lots of patients. We have the heel rises there. What's wrong with the picture for the heel rises?
No looks like the waves on the outside.
They're not holding on to anything. Okay? You're never going to give someone, yeah, and the form is not the best either.
But it's a drawing.
Yeah, and probably not drawn by a PT. Lee was listening to me making it, and some of them I was like, oh, why is this here? This is terrible. Yeah. Why would you ever have your patient do it that way?
Dr. McGuire, at CSM, there's this company that we have the pictures is DHI, but there's lots of companies now that have them on. They have a picture of a person really doing it, and then they video it. So, but that's just more cost. But this is a great program. Every clinic has it.
Pretty much. Okay, so quad set. This is isometric of the quads. Okay, so it doesn't really look like the guy's doing anything, but what is he doing? He's pushing the back of his knee down so that his quads tighten up. Okay, it's the first standard exercise whenever someone has had some sort of knee surgery or even hip surgery, just to get the muscles working again. Okay, so you'll have your patients do quad sets all the time if you're in inpatient or SNF. That'll be one of the exercises they can just do in bed at any time. Okay, and then next we have the hamstring set, where you're digging the heel in. Okay, so usually when something's called a set, it's referring to some sort of isometric exercise, muscle setting. Okay, so again, there's no actual movement, but you're getting them to recruit their hamstrings. Okay, then we have the straight leg raise, another super, super common lower extremity exercise, no matter who the patient is. Okay, so what muscles are being used for the straight leg raise?
Rectus femoris especially.
Yes, so quads. Don't say VMO to me, but you guys haven't learned that yet. The VMO personally offends me. It's not a real thing.
What? It was on one of the slides.
Yes, you'll hear it in the clinic, but if anyone has read research articles, then you no longer talk about it. Okay, so you have isometric quads at the knee, isotonic rectus femoris and hip flexors. Everyone see that? So it's often used as a knee exercise to see if the quads can stay on isometrically, keeping the knee straight as the hip flexors and rectus bring it up and down. Okay, there's your straight leg raise. Let's turn to the next page, the back. Okay, we have hip extension. Remember first, before you did prone hip extension, you would probably do a glute set where you're just cueing them to squeeze their glutes together. Okay, and then we have side lying hip abduction. Okay, the step before the side lying hip abduction would really be a clam. I don't think I included a picture of that because they didn't have a very good one. You guys remember? So picture this guy on his side, but his top leg in the same position as the bottom leg. And then you keep the feet together and open the knees like a clam. Okay, so it's hip abduction with external rotation. We all did it on the mats back there. What did you do? Spoon each other?
I remember that.
Oh, yeah.
Tried to forget it.
Okay, so that would be a little easier than this full straight leg raise on the side. The clam. Okay, once in a while you have them do adductor strengthening. You just switch the legs, have them bring the bottom leg up. Okay, then we have our short arc quad where you'll have like a foam roll, a towel, a pillow under their knee. And then you're having them straighten their knee. So it's a progression from the quad set. You're still cueing them to push the back of the knee down into the pillow, but now they're getting isotonic movement. Okay, so the tibia is going to come up and down. The one directly underneath that is the long arc quad. Okay, where now they're sitting off the edge of a surface, going through a larger range of motion than the short arc quad. Okay, and then here we have standing knee bends. What muscle are we working here? Hamstring. Okay, so this would be one progression from a hamstring set because now we're actually moving through a full range. Okay, last page. It's a little bit more upper extremity. We have the pendulum. Remember, the pendulum is supposed to be passive. So the patient is supposed to elicit shoulder motion by moving their trunk. They're not actually supposed to be actively moving their arm. Okay, that's a key distinction. Here we have serratus punches. So you're essentially doing against gravity protraction. You can do it with or without weights. Okay, you're on your back and you're protracting, coming back. So there's actually no arm motion. The elbow should stay straight. You're moving from the scapula. Okay, really common shoulder back exercise are your Ys and Ts. Notice in both pictures the thumbs are up. It's very, very important that the thumbs are up. If the thumbs are parallel or down, you're working different muscles. Okay, so the first one in the T, you're making a T in prone, and you're bringing your arms up. What muscle is working? Mid-trap. Okay, so T's are specifically for mid-trap. Y's. So now you're making a Y. Low trap.
Oh, because of the shoulder blade.
Because of the position of the shoulder. Okay, so this is that. Y's are actually a low trap exercise. Y's, not I's. This is I, this is Y. Because there are I's too.
Yeah.
And then there's M, and then there's C. I'm sorry.
And W.
Hey.
Okay, W's this way. What muscle? Rhomboids. The Y's are, W's are technically rhomboids. A really common, again, another isotonic exercise you'll see is sideline shoulder external rotation or lateral rotation. And again, you can add a weight to make it a little bit more difficult. Okay, so I want you to be comfortable with knowing how to instruct a patient in these. Know what the goal is, because you have to be looking for and correct for compensations. Try to be familiar if they have a specific name, because you'll hear those names used a lot. And know, if it's strengthening, what muscle is it targeting? If it's stretching, what muscle is it targeting?
On your practice test, there's a question about a patient who's in bed bound for a few days or months, and it says it's the most effective muscles is the quadriceps. What is
the what?
The quads. What's the rationale behind it?
Okay, so some of those questions you have to take with a grain of salt, and I'm not going to ask you something about that, but that is a good question. In general, when you are immobile, it's going to be the power fast twitch muscles that are going to decline quicker than the slow twitch endurance muscles. Okay, so the slow twitch endurance muscles that we use are used to having lower levels of stimulation, but for longer periods of time. Big power muscles that are made of fast twitch muscle fibers are going to decline quicker. Okay, so in general, what are our big power muscles? Quads are a big power muscle. What else? Hamstrings are a little bit, but quads more so. What else? Lats, biceps, glutes. Gastroc soleus is an endurance muscle. Our back extensors are endurance muscles. Okay, so muscles that are on just a little bit but are working all day long to hold us up, those are our endurance muscles. Muscles that are going to help us produce a lot of force to move either ourselves or an object are our power muscles. And those ones atrophy quicker with immobilization. Okay. Any other questions? Okay, so a couple other notes, and we'll have time to talk about this tomorrow. If you're going to inpatient or sniff, likely they've asked you to wear scrubs or a white coat. That's usually what you wear. I don't know. If you're not going to inpatient or subacute, then you're not being asked to wear that. Okay? But anywhere you go, an extra PSA reminder, universal precautions. Okay? It's not just about keeping the patient safe, but keeping you safe as well. Okay? So you're washing your hands all the time. If you're going into a sniff, it's not a bad idea to bring a change of clothes. Because otherwise you're bringing those germs with you into your car, into your home.
Like carry hand sanitizer.
And it's not a bad idea to have hand sanitizer in your car. Okay, so if you follow universal precautions, you know, the germ transfer is minimal. But it's not a bad idea, especially if you have elderly or children at home, to change at the actual facility.
So just have an extra change of clothes in your
Just, yeah, and then you change into your scrubs when you're there. Change into your work clothes when you're there. Okay, even shoes. You know, like take your shoes off before you walk into your house. Not a bad idea. If you're going to be in one of those environments, okay? Because when you're in an environment where everyone is sick, there's a lot of germs going around. And kids are little germ pods, too.
Oh, yeah. I know. Everywhere.
Some of you are doing pediatrics.
Touch this, but
But it's because their immune systems are new, so they haven't developed immunity to a lot of things yet. So that's why they tend to have more germs.
What about for outpatient?
Outpatient, you don't have to worry about the germs as much. You're still cleaning the tables, you're still washing your hands, you're not coughing or sneezing on your hands, but there's less germs floating around, so you don't really have to worry as much. Like, in outpatient, the average germs that you're contacting in a day are pretty much the same. So it's not going to be as vital to remember that. Okay, so when in doubt, we'll always wash your hands. And notice, like, if you do have the habit of, like, touching your nose and your face a lot, it's not a bad thing to be aware of and try to break that habit. If you cough or sneeze, it should always be into your elbow, never into your hands. Just be clean and be safe. Okay. We should have 2 more pulse ox around. Do you have those anywhere?
There's one in the back table.
One more. I am going to assist someone in doing a pelvic alignment assessment if you'd like to watch it. If you would like to go mentally rest or do something else, we are officially done. Please make sure you sign in so I can give you credit for being here. Your uniform, okay, you don't have to wear a professional dress for the little job fair, just wear uniform is fine. Okay, but wear your uniform so you look clean and neat. Because remember, we're going to go down to the job fair after our clinical meeting tomorrow. Just briefly.
all right, everybody. We all take a picture.